Welcome to part 3 of our 4-part digital event series, Confronting a Pandemic, jointly developed and delivered by STAT and Harvard Medical School. Thanks for being here. I'm Casey Ross, a national technology correspondent for STAT. And in just a moment, I'll be joined by my co-moderator and our featured speakers to talk about digital technology and data use during the COVID-19 pandemic. But before we begin, a few quick instructions for you. At the bottom of your screen, you should see a few icons. There is a chat icon and a Q&A icon. Use the chat feature to chat amongst yourselves or to send a message to the STAT team. If you find you're having any technical difficulties, tell us in the chat. Do not put your questions for this panel in the chat. If you do have a question that you'd like to ask one of our featured speakers, please use the Q&A feature to type your question over to us, and we'll try to answer it live. Again, we will not be taking questions from the chat feature, so please do type your questions into the Q&A. I'd now like to welcome my co-moderator, Stanley Shaw, Associate Dean for Executive Education at Harvard Medical School, along with our two featured speakers, John Brownstein, Chief Innovation Officer at Boston Children's Hospital, and Dina Mendelsohn, Director of Health Policy and Data Governance at Electra Labs. Welcome everybody, and I'll pass it to you, Stanley, for a quick introduction.
Thanks, Casey. So as businesses plan how to reopen amidst COVID-19, there's great interest and even hope that digital tools can help with disease surveillance, contact tracing, and enforcing social distancing. Employers, public health departments, and large tech companies are all joining the effort, but many questions remain unanswered. Will the tech work? How do data rights or privacy fit into the equation? Do we have enough transparency to allow individuals to make informed decisions? Our panelists will bring their perspectives to these questions and your questions. John Brownstein developed disease surveillance tools like Health Map and COVID Near You. And Dina Mendelsohn is an expert on the benefits and risks posed by connected technologies through her current role at Electra Labs and previously at Consumer Reports. Welcome, Dina and John, and thanks for joining us. John, maybe I can start things off with you. So if you think about the capabilities that are needed for COVID public health and reopening society, tell us what are a couple of things that you think tech can do particularly well? And maybe at the same time, tell us one thing that people are optimistic that tech can do well, but personally you're less optimistic about.
All right, well, thanks, Dan, and it's great to be here. I think this COVID pandemic has shown some bright spots, and that is the amount of collaboration and innovation that's happened to really think about building a better picture of the pandemic, to build an understanding of the role of interventions. So there's been a lot of really interesting innovation. I would say, generally speaking, there's a lot going on with a lot of people and a lot of time on their hands, a lot of technology that's been built and put forward. And so clearly some level of confusion, but there's been incredible collaborations as well. And I've seen some amazing efforts that range from building better data sets to understand when we've got to peak and more importantly, what is reopening doing to impact the emergence of cases? So clearly, when you look at the data like hospitalizations or deaths, that sort of that's a lagging indicator that those things we see weeks out. We want to see real impact of reopening quickly, and that's usually can be done through symptom collection and getting sort of the early signs of mild illness. So tools like chatbots and symptom checkers, as well as a number of sort of online-based survey tools. We run a project called COVID Near You. There's another app called How We Feel. There's the Zoe symptom tracker app out of MGH. There's a number of these tools that are giving really important sort of situational awareness or epidemic intelligence about where we stand as sort of we're on the other side of the epidemic curve. And so far, with definitely some state outliers, most are trending downwards. So the combination of these tools both are sort of engaging people to better understand what's happening. They're also sort of providing real insights to public health and decision makers. So that's some real excitement, and I think it's been we've seen the value immediately, and there's been a number of publications that have come up. I would say the big sort of sort of question mark in my mind. And I wouldn't say I'm necessarily negative on it, but it's still an open question, is around the technology that's sort of been put forth on contact tracing. And now, it's been an incredible amount of work that's happened through companies like Apple and Google to come together to create an infrastructure that can enable public health departments to do contact tracing sort of based on mobile phones and Bluetooth and Wi-Fi. In practice, we're seeing some pushback, both from the population and the concerns around releasing that data, and public health departments either not having the capacity to launch these things or really turning to more sort of basic shoe leather epidemiology. Now, there's a tech component of that because there's symptom checking, there's recontact, there's applications and tech that is part of sort of the more sort of human in loop contact tracing. But the sort of pure app-based approach is, I think, still a challenge. And of course, it's always hard to build a plane while you're flying it. And so to introduce these new concepts, technologies in the middle of the pandemic, and we can talk about that a little bit, it makes it a challenging proposition, even though a lot of people are very engaged and clearly want to see the light at the end of the tunnel.
And Dina, a question to you. As John just referenced, data is being used to build a multitude of different types of products, to help with response and tracking during the pandemic. Some people have suggested we need to trade some amount of privacy in order to protect ourselves during the pandemic and against future viral threats. Do you agree with that?
No, I don't. I'm going to resist the temptation to allow this to be an either or. It's not a question of do we get privacy or do we get safety. The immediate threat of COVID-19 doesn't negate the very real risk that comes with data being used inappropriately. So instead, we need to address head-on the fact that Americans have very little data rights, and the protections they anticipate from HIPAA are in many cases just a mirage. Once true data rights are set in law, then we can respect privacy through data governance. And we do know that there are 2 bills that have been introduced in Congress that would say that, yes, we can have this surveillance or early monitoring technology and also protect our data rights. But those are just 2 bills that are introduced, and it's a question of where they're going to go from there. I think that with more trust in the system, we're going to see more participation in the system. So these early monitoring programs that are being stood up, they're not going to work if people aren't actually downloading the apps or using the technology. And right now, it's my understanding that in surveys, we're seeing that half of people don't trust that their data is going to be used the right way. So in the meantime, in the absence of comprehensive privacy laws in the United States, individuals will have to rely on product manufacturers and app platforms to protect their sensitive information and to follow best practices in data rights. Also, platforms are going to have to be responsible for policing the data that they collect and blocking potential abuses.
So that's a perfect jumping off point, right? So in the last year, there was a study of mental wellness and smoking cessation apps done by John Toros at the Beth Israel, and he looked at 36 apps, and he found that 32 out of 36 were sharing some kind of user data with analytics or marketing companies affiliated through companies like Facebook and Google. And of those, half of them weren't really disclosing how that data was used. So I think this is both for John and Dina, on the tech side, on the building side, and on the public kind of trust framework. I mean, why do we think that things will be different for COVID? Are there new safeguards, or is it we're hoping that there's a different ethos this time around?
I'm just going to jump in and ask why we should think that our data rights should be different for COVID-19 than in general. I think as a basic premise, individuals should have data governance over their information. So nobody's saying we never share information ever. We're not taking this information, we're not locking it away. We're just saying individuals should have the ability to decide what information they share with whom and when, and how long that information should be held. So I think in the world of COVID-19, everything is getting accelerated a lot faster. the doors are opening up and people are realizing what's going on with their data. But when it comes to the technology that we're using, I think the ones that say that they're going to give people their data rights and they're going to be careful and they're going to respect what the data can do, those are the ones that people are going to download and the ones that they're actually going to use. And hopefully in the marketplace of monitoring app, we'll see the devices and the monitoring technology that's put forward that has strong data rights. Those are the ones that will rise to the top. I'd like to see that adopted by other technology and other platforms in the future across the entire hemisphere of this type of technology.
I mean, I think COVID is creating both an opportunity for more to be thought through on that front, but I also think it's creating a lot of confusion. We've never seen this much sort of public health tech development, by far, right? So we've been doing this for many years. The numbers of groups at the table building things, collecting data from the general public, and the things that look very similar to one another. I learn about a new sort of tracking website every single day. And that's somewhat concerning because I think it's creating a lot of confusion to the general public about where their data should go. A lot of people probably are not thinking too hard about it, but at the same time, the motivations of these tools are not very clear. There are a lot of groups collecting data, sometimes just for the sake of data. Sometimes there might be some ad targeting, but these tools don't do necessarily the best job, other than incredibly high level sort of view of why people should be contributing information. Not to mention, of course, the leveraging of sort of passive data through social media and other tools. I think I don't think there's been enough of a spotlight on sort of the appropriateness of these technologies and what they can do and being explicit about what they can and can't do.
I think also one issue to consider is that with the confusion or the excitement over standing up individual platform, we may have an issue where if a group of people download one type of app and another group of people download a different type of app, and these apps aren't sharing data with each other, then we're not going to be able to create the comprehensive picture we need in order to identify hotspots.
Yeah, I would agree with that. I mean, there's a huge amount of fragmentation that's occurred because of the flurry of innovation. I don't want to say this is 100% the motivation, but there has been at least some level of, needing of companies to show that they're committed to COVID. So there's always that sort of, how do we do something to build something that then gets a good press release and shows our commitment? And I'm not saying everyone's doing that, but I think it's fragmenting a lot of the efforts because, that collaboration can somehow dilute your sort of press announcement. And then, so I think you're better off building something yourself. And now, the people in public health are left a little bit holding the bag, trying to figure out how to bring these things together and create some interoperability when maybe that didn't even need to be the sort of starting point.
Yeah, how do you address that kind of fragmentation? I guess one of the questions that's come in from a listener is, how should the government work with the private sector on this? I think government is loath to pick winners and losers, but does there need to be a different response in this? Should the government be sort of picking up on specific efforts and trying to drive uptake to them so that you do have the kind of coverage and comprehensive picture that might be needed?
Yeah, it's a real problem because, clearly, from the government perspective, maybe you want to encourage innovation and an ecosystem. But for, like, say, the contact tracing work, the fragmentation is harmful because, people on different platforms that are not talking to each other, then all of a sudden your information on sort of contacts is minimized. That's why we have seen efforts at the state level, at least, that are sort of fairly cohesive, but they have relied less on technology and more on sort of call centers and huge sort of workforce of people responding and calling contacts. But yes, for sure, I think in this particular case, sort of a national effort that sort of includes tech companies, and we're seeing that great collaboration between Google and Apple. I think having that buy-in, I think, would be super important for even to have a chance at sort of mass adoption.
Yeah, I don't envy the work that public health departments across the country are having to do. The spotlight is on them. It's their job to protect the public, but there's also going to be a very steep learning curve. they have always done contact tracing, but they haven't had to do it at the level that they have to do it now. And so they are going to have to adopt technology into their practices in order to just speed things along and be able to handle the influx. And I think that there's going to be a difference in what the capabilities are in public health departments on a local, regional, state, and national level. And so it's kind of hard to lump them all together. Another thing that we're thinking about is just that technology is not all exactly the same across the board. So a lot of the biometric monitoring technology that can be used in order to monitor COVID-19, it existed long before COVID-19. Electra Labs has been looking at all the evidence that supports these different types of technology in order to explain what they are appropriate for, what they're not appropriate for. And so I think we may find some issues crop up where different types of technology are creating measures that seem very similar, but they're actually not the same. And so public health departments are going to have to figure out what vital signs they're looking for, what symptoms they're looking for, what's the right way to measure it, and then how do they get the technology out there so people are able to use it. And also acknowledge that there are different parts of our society that have access to some types of technology that other parts don't have. And that could also leave us with a gap of information. If there are communities that don't have access to some of these measuring tools, it may look like they're not struggling with COVID-19 when there actually is a flare-up.
So maybe we can try to explore some of these issues through some specific use cases. So John, you worked on COVID Near You, and previously you had kind of crowdsourced flu surveillance that worked with the WHO and governments, CDC, et cetera. So, you know, if we take the example of COVID Near You, maybe you could explain what it does, but it seems like that's an example of something relatively straightforward, but you have interactions or collaborations with the state, I believe, and beyond, and also with private companies.
Yeah.
Like I think you're working with Buoy Health, you're working with other companies. So how are you navigating, you know, the tech, the capabilities? What do you hope for it? And what's the process for the data privacy and these kinds of issues?
For sure. And so we've been running sort of what we call participatory surveillance for actually getting close to a decade. This idea that if you just ask the people how they're feeling, they might want to contribute and be part of a sort of the public health fabric. It was actually a technology, Flu Near You, that we built as part of the movie Contagion that essentially was a sort of social call to action, not realizing that, you know, Contagion was basically the exact, you know, very close to the same virus that sort of ultimately emerged 9 years later. But the idea was, you know, it's so challenging to get data from health systems, and clearly we know the challenge of testing today. Why not sort of engage people in public health, have them contribute some small amounts of data, protect the privacy, of course, and only share de-identified aggregate information, but give insights like what are the demographic features, what symptomology can we understand, what is the impact, you know, the efficacy of a flu shot. And so we've been rolling this out for years and in partnership with local, state, public health and CDC. And so we've been able to sort of bring new technology to government entities, but not put them in a position where they have to run the technology. And so we could remain more nimble, share data, but not sort of be under the sort of restrictions that, you know, are more challenging under like a government entity like CDC. So that's been going. And then clearly with COVID, we recognize that some of our technology might be valuable, but it was not scalable to the potential sort of volume that we would get in engagement. Clearly, there's a lot more interest in sort of seeing crowdsourcing COVID than, you know, any particular flu season. So we engaged companies, engineers from Google and Apple and Amazon, who all sort of donated their time to us and helped us rebuild the system from scratch. And from that perspective, and Sidewalk Labs was another collaborator. And from that, we were able to relaunch in a sort of better user-friendly, sort of more nimble, more modern approach. And then back again, so leveraging the resources of those tech companies, and instead of them reinventing the wheel, they supported sort of a system that's been around for a long time. And then through that, we've been able to sort of communicate sort of in findings of the data that we've been collecting. And so, you know, it's still challenging to keep people in these types of tools, keep crowdsourcing going, keep people engaged to want to report weekly. We're still seeing a lot of engagement, but clearly that's going to wane over the summer. And so we're going to be focused on figuring out how to build up that participation coming into the fall, so that we get that early insight of that second wave as it might come, in October, September.
And then any precautions when you pipe or somehow share your data with, privately held startup tech companies?
So we're not sharing the data with any companies. We share it with public health departments and academics. They go through a DUA data use agreement process with Boston Children's, and there's very specific guidance on how they can use the data, and it's shared in a de-identified manner. So the reality is, there's no ability to reversely identify anyone. There's no sort of personal identifiers that are shared, but the data is not going back out to any private companies.
Great, thanks.
Dina, I wanted to jump in with a question for you. You mentioned at the top the fact that during the pandemic, it's focused a lot of attention on data privacy issues, and on Capitol Hill, as you referenced. There are some bills, but so far not a lot of bipartisanship surrounding those bills. So I wondered, sort of, as somebody who follows this, what hope do you have that there may be a moment where there can be some consensus that emerges around a bill that could get passed? I mean, do you think that could happen in the coming months?
It's a great question. It's always awkward to answer a question about how do I feel about getting consensus on the Hill. It will be challenging. There already were a few bills on the floor for privacy in general, and those did not move. The new bills are extremely targeted on COVID-19, and the potential for them to move seems a bit bigger because the public is kind of staring at them. A lot of technology companies need these bills to pass in order for people to feel comfortable with using their application. And so something that we've seen these two bills narrow down on, which was a nice change from the past, is that there wasn't as much of the opt-in, opt-out language. So in the past, we've seen individuals have the right to opt out, which puts people in the position of having to police their data all the time, which is just not appropriate. And so it is good to see that there are those limitations are not in the current bills. So they are not putting people in the position of having to constantly police their data. But we'll keep in mind that that's because these bills are really limited to COVID-19 information. These bills also have other great data minimization pieces to them. So they talk about only collecting the information that's needed and not sharing it inappropriately. And they also include something that we've always thought was critical, which is data deletion. And the idea there is when you use an app or use technology to collect data, at a certain point, that data may not actually be necessary for operational purposes, or an individual may decide they didn't want their information used anymore, and so they request it to be deleted. And these bills do contain language about deletion, so that is good news. In terms of whether these bills are going to move on the Hill, that's not something I'm going to be able to guess at this point. They probably have a better chance than other privacy bills, but like I said, those bills didn't go anywhere. So I would like to think that anything would have a better chance than that.
And John and Dina, also feel free to jump in on this one after John, but I wanted to ask you, John, about use of social media data in this, because I know this is an area where there's a lot of potential to be able to effectively use this data to track outbreaks as they occur, and to get out vital information to people. But on the one hand, this is information that's out there. It's publicly available. It's publicly reported. But on the other, people may not anticipate that it's being used in some of the ways that it is.
Yeah.
How do you think about that as you think about how to effectively respond?
Yeah, I mean, I think it's very platform to platform dependent. We've been working in social media mining for a lot of years with a lot of different applications. Clearly, there are emerging signals that come from people's disclosures of symptoms or opinion and sentiment that can be incredibly valuable for public health. And, we use that data in the ways in which people have agreed that their data could be used in those public forums. Now, I agree that there's always a sort of challenge, like, do people fully recognize how the data is being used? I mean, we make our results public. We make whatever tools that we build public. And the pushback or reaction has always been incredibly positive because the reasons behind doing that have all been sort of in support of public health. And clearly, there are a lot of applications of that data that are really all about sort of ad targeting and other sort of other types of reasons why one would do that. So generally, we've seen a lot of amazing acceptance, and we've done a wide range of surveys of people on social media platforms to get an understanding of whether they accept that this data could be used in that way. And generally, we found that people are very much in favor of that application as long as it's done in ways in which we're not sort of reversely sort of pointing at someone with a particular condition or a particular opinion. I think where the social media work is going to be incredibly powerful in the coming year is not really necessarily about disease tracking, but it's going to be around sentiment and sort of beliefs and attitudes on the vaccine, because the vaccine is a huge point of optimism, but also contention. We already have, a huge amount of resistance to immunizations in the country, and racing at a vaccine that, it's going to be tricky, at the pace that we're trying to put it out. There'll be concerns around safety profiles. And I'm very concerned about the sort of pushback and resistance to the vaccine. I think the signs of whether people will be willing to get immunized will come from social media. So those tools will be incredibly powerful to track sentiment, to track rumors, and figure out how to properly sort of communicate back to the public given those sort of findings.
Yeah, so program note, in 1 week, next Thursday, the last in our Harvard Med School series, we'll have a little update on vaccines and public health. So that's obviously a critical issue. Can I just follow up briefly? Do you have any insights from social media sentiment about tolerance for staying with the shelter in place versus opening up?
Yeah, I mean, clearly, these social media platforms tend to breach through positions. And so, we're absolutely seeing sort of the wide range of perspectives, those that are sort of adhering and supportive of public health, but then we're also seeing sort of this, which I find amazing, this sort of anti-public health establishment, like there was some public health establishment that existed before, so grossly underfunded group of people that have just been sort of stitching funding together for a long while to just keep this work going. So somehow that there's some, and then also, I guess I also hear it referred to as pandemic porn, where epidemiologists are just trying to push an agenda of fear so that they can stay on the news or get more op-eds published. So that's an interesting sort of dynamic that is playing out, and that plays out very clearly in social media, where there are there's pushback and concern about data and findings, and that's also sort of against the backdrop of really fast publication of science. So with the Med Archives and the quick publication of unpeer-reviewed findings, and then the sort of rapid peer review that happens on social media ahead of publication in a journal changes the conversation, and in some ways helps push things forward. But I think it is also somewhat polarizing people in terms of their interpretations of these findings in real time. So we're seeing that all play out incredibly on social media.
Yeah, so there's a couple of questions. Maybe I can tie them together, and I think this could go to both John and Dina. It's about maybe lessons from international COVID hotspots. So, are there things on the tech side or on the privacy data rights side where we can learn from the experiences of other companies? I mean, one data point is Singapore, I think people think has done pretty well. They had an app, a national government app for contact tracing, I think, and they had a million downloads, which sounds pretty good, but the conventional wisdom seems to be that that's not enough to make it effective, right? You're not penetrating enough of the population related to something we talked about before, right? These fragmented contact tracing apps. So are there lessons that you see from abroad?
Well, one caution that I would make is that as we try to look at lessons from abroad, we need to recognize that each country is unique. And so they're unique not only in terms of their population and demographics, but also in terms of their laws and their data rights and their population preferences. So a system that requires everybody to download an app onto their phone and make that a mandate is not going to work in the United States. We have a lot of people who feel very strongly about their privacy, and we also have a constitutional right to privacy. And so we cannot tell people that they need to download apps. What we need to do is get them to buy into the system and download it voluntarily. But when we look at countries, I believe it was Finland that had a relatively high uptake of voluntary apps, it was only 40%. And my understanding is that it really wasn't as effective as it could have been if it had a much broader uptake. So I think that one lesson we are learning from international places is just regardless of why an individual downloaded an app, the more people who are downloading apps that are either sharing data with each other or are this one app that's been streamlined across the country, the more effective it's going to be.
Yeah, clearly the places that have had effectiveness are, a real national healthcare system, a sort of a government that can, mandate certain things, and generally countries that have been somewhat more isolated, not as having as much in and outflow. So, island nations and places that, are less connected. It spells a much tougher situation for the U.S. in that, we don't have a national health system. We also, our CDC sort of is in support of state and local public health. It's not, that CDC has jurisdiction across the entire country. So we have these multiple complexities plus a huge amount of travel in and out into many different ports of entry. We can debate whether we would have been able to, if we had done things earlier, whether we would have been able to, do the sort of isolate and trace. But I think we don't have the best setup in the US to be able to sort of to do those types of activities. And again, on top of the fact of what Dina says with mandating apps on the phones is just not doable. So many different complexities that sort of prevent us from looking like a Singapore or Taiwan or Iceland or Finland.
Yeah, I think that when you bring it all together, also, we need to remember that technology is not going to be the solution. Technology is a tool that will contribute. So if we don't have a safety net, if we don't have an operating nationalized health system, then the best tool is not going to fix everything.
A quick follow-up for you, Dina, from the question I posed earlier from an attendee wanted to know, why did the privacy bills that had been on the Hill prior to the pandemic, why did they not move? Is that due to sort of the generally polarized environment, or are there sort of specific sticking points between the parties over aspects of those bills?
I would say generally polarized environment, and it's just very difficult to get any bill to move in this current Congress in this environment. And there's a lot of different positions and opinions on how we should protect people's data rights. There are some bills that were extremely narrow that would not have actually created a comprehensive privacy law. And so there were some advocates and lawmakers who preferred to wait until a better bill came to the floor. And then there were other more comprehensive bills that just weren't able to get the support they needed because of the current political environment.
And John, I wanted to ask you a question about something you've been working on for many years now, which is about surveillance and detection of viral threats. AI is being applied to this. There's been some amount of hype about this. And I wanted to ask you, sort of in your experience, where is AI and sort of big data making a difference this time around? And how does that compare with what you've seen in prior outbreak situations?
Yeah, I mean, listen, there's a lot of focus on, AI and machine learning as being a savior And there were some really I guess, attention-grabbing headlines to try to make the point that AI can serve us in pandemics. And I think to a certain extent it's true. I mean, we've been running a technology called Health Map for 16 years now, which is all about mining the web, news and social media, looking for clues about disease outbreaks. And we did identify this sort of mysterious illness December 30th in a market in Wuhan, talking about, this illness that, had a dozen people in the hospital. Truthfully, that looked like many other alerts that we identify. So parsing that versus another, respiratory alert that we get in the system, which we get thousands every day, is hard. Probably a system that did an incredible job is a system called ProMed, which is a network of, infectious disease experts around the globe. And they quickly tuned into that alert and helped sort of support the reason why we should care about it. And it really sort of highlights the value of the sort of machine-human hybrid, rather than sort of, this whole sort of data mining approach that provides us, the best possible data. What we found is that the mining of information can help seed a database, and in the time of COVID, the amount of data is just insurmountable. Pulling that together, but then having humans in the loop that are helping curate information. We built this global line list of cases that served a whole bunch of purposes in modeling and forecasting. Even here in the US, there's a site that a lot of people are looking at, COVID tracking, which has done a phenomenal job. But that's a big volunteer effort. There's some sort of automation that's happening, but it still requires human in the loop. And so, while it's a great headline to say sort of AI identified and sort of ahead of WHO or something like that, it's not exactly the right story, because WHO was alerted, they knew about it, clearly wasn't necessarily pushing out a lot of content to the public, but I think that, again, we're not at a stage yet where data mining is so good that we can't sort of rely on the sort of human expertise to help sort of provide context to the data that's out there.
And are the data miners working with the CDC and the World Health Organization? I mean, is there a pipeline? Is it a sort of a two-way street there?
Yeah, I mean, for sure. So there's the CDC runs this event operating system that they also have a public view of, and they pull in data from all the sort of the ecosystem of tools that are out there that are mining all that, what we call epidemic intelligence. And they're sort of the one aggregator of this data across multiple platforms. And then they're the ones that are making the decision of what to respond to. Now, there's not necessarily a great feedback loop, so you don't get a lot of insight back. So it sort of hurts in our ability to tune these models, I think, over time. And so that's always something that we're trying to strive for, is to get that sort of feedback, sort of to improve the algorithms that we're building.
And maybe just one more follow-up on that theme. So what do you think are the potentials for aggregating kind of disparate data sets, right? So you'll read in the papers that it's not just public health department data, but it's also airline bookings or restaurant bookings or whatever it is, right? Devices in airports, temperature scanners. Is that, I mean, do those disparate data types add value, and presumably they add additional privacy risk as well?
Well, I'll let Dina mention the privacy risks of mass surveillance. But if you take away that part of it, which I'm sure she's gonna have a strong opinion, what we have found that integrating disparate data sources provides the best possible sort of view of truth. And so, in this pandemic, we've seen a lot of work happening from the wearable companies, the smart thermometers like Kinza, social media mining, Google search query data, crowdsourced information, case testing data. So all that data to combine is providing a better view, because clearly each data set has its biases, each data set has a bunch of noise that's built in. So the more you can begin to integrate those views, the better. And there's no one particular data set that does best. They all sort of have their individual properties, but as a collective, we have found, and we've not just seen this for COVID, but for flu and for dengue and other epidemics, integration tends to be the best approach. And in fact, Carnegie Mellon University put up a site that's really great, that's including Google's data and Facebook data, and they have been able to show best possible forecasting through sort of all those data streams.
I'll just jump in with the data rights part. Surveillance is going to make anybody feel uncomfortable, I think, for the most part. Nobody wants to get COVID-19. We do want early monitoring systems so we can know if there's an outbreak in some areas. And also so we can know when we can go back to business as usual in areas that aren't experiencing COVID-19. And so I think that the thing to remember is that there's smart ways to use data and there's irresponsible ways to use data. And so when we're aggregating this data together, we just need to remember that even when you de-identify, we all know that it can be re-identified. And so sometimes it's going to be extremely hard, but it's never going to be impossible. And then when we think about aggregated data, if you put data together in an extremely large data set, then sure, you're probably not going to narrow down the individual. But in some areas of the country, there aren't that many people who will fit a certain demographic criteria. Or if you're going to say a zip code, that's a big bunch of people. But if you're going to include a zip code +4, well, now you've really narrowed it down so much that I know who we're talking about. So it's not, nobody's saying we don't want any type of early monitoring or surveillance systems. What we're saying is that this needs to be done thoughtfully, responsibly, and with a lot of transparency. So we want to know what the privacy practices are going to be. We want to know what steps are being taken. If we're talking de-identification, people should be transparent about their process for de-identifying data, because that is not, there's no one approach to de-identifying data. And then again, when we're talking about algorithm, if we are transparent about how those algorithms work, then we're going to trust more in the system using that algorithm. Mistakes are made. Some algorithms are made by humans. So even if somebody does something unintentionally, if we're not transparent about how we're working, then there isn't an opportunity for people to look at it and make sure this is something that we should all be comfortable with.
So can I ask now if we transition from governments to private companies, right? So I think people's willingness to share data, the conversation is just different if you're talking about your employer. But employers are thinking about their own homebrew, maybe they're building it themselves or they're buying it, but the same set of issues and solutions that we've been talking about. So companies are saying, well, we can have a symptom attestation that we require every day. We can have, maybe weekly or periodic tests. We can have location or proximity beacons and sensors. Are those, practical, right? So again, will it work? Does it have the feasibility to let companies open up, keep people safe? And what's the data rights conversation there?
Yeah, I think it's a great question. It's actually, interestingly enough, we're at Boston Children's looking to launch a contact tracing application. Now, there's pros and cons. Clearly, an application that's just for employees is missing a huge set of your contacts. So it doesn't have the same sort of ability as sort of a widely adopted tool. But at the same time, I think you have a little bit more flexibility, and I'll be curious to see what Dean says of this, but on phones especially that are either owned or controlled by an employer, there's a lot more flexibility in installing applications. And clearly there are a number of companies that already do this to monitor phones and other information. But from that perspective, in my view, actually, I think these technologies will have, these Bluetooth sort of contact tracing technologies may have more success in the enterprise setting. In our hospital, we forked over code from an MIT effort called Private Kid or Safe Path, and which was sort of leveraging the Google Apple concept. And they've had some good uptake, but at the same time, some of the challenges that we've discussed so far. So being able to take that code and then implementing it into a private server, the data is hosted by the organization and with the right types of privacy and sort of use restrictions in place. We're looking to launch this, and clearly for our ability as an institution to have information on which employees have maybe come into a contact to help sort of stem sort of infection in the hospital is super critical. And I think that's code that we're going to hopefully launch an open source, and that other companies can take advantage of as well.
So I think that one of the risks that we get when we think about businesses and employers relying on technology for reopening and resuming business is that most employers do not have a background in medicine and in this type of technology. And so my question is, how do we ensure that employers and businesses are adopting technology that's appropriate for COVID-19 and that isn't bleeding into data rights or privacy violations? So one example is an employer may elect to take the temperature of employees when they come into work every day. And that information is only needed at that moment, and there's probably little or no reason to record that temperature, especially over a long period of time. And so an employer that has somebody standing at the door, or a business even, that has someone standing at the door and taking people's temperatures as they're entering, they are not going to have a data rights issue like a company that has a camera that's automatically monitoring temperatures of each person that comes into the store. Once you have a camera set up that's automatically measuring the temperature of people come in the store, then we're going to start wondering about facial recognition technology, which goes into surveillance. And then you also have to question how long this data is being held. So take my temperature today, confirm that I don't have a temperature, fine. Take my temperature every day and create a picture of me over the course of a month and then don't delete it, that's a problem. We also need to make sure the technology is used appropriately and measuring the right things. So women in general will have their temperature spike at one point during the month, each month. And that does not have to do with COVID-19, that just has to do with basic biology. So an employer that's not familiar with this, and they should not be getting into women's health issues, but an employer that's not familiar with different things that a temperature may indicate may make the decision to send an employee home, and that decision would be unreasonable. And so the things that we need to figure out is what symptoms and signals do we actually need to measure with digital tools, and we need to make sure they're actually up for the job. So one of the things that we look at Electra Labs is we make sure that technology is accurately measuring things, it's measuring the right things, and it's appropriate for use in that situation. And I think that really lends itself well to this kind of conversation. As employers and businesses start using more technology and start putting apps onto people's phones, they need to make sure that the technology they're adopting is appropriate for what they're going to be using it for.
Just to clarify, can an employer mandate an employee download and use an app on their phone?
I think the answer is going to vary depending on whether the employee owns the phone or whether that's an employer-owned phone. But employees should always know that if they're using a phone that was supplied and owned by their employer, the employer owns all the data that's on their phone. So if your employer gave you a phone and then says that this app is going on the phone, then yes, they do have permission for that, and they do own the data. And you also will want to look at the permissions and see if that app also may be collecting geolocation information or other information that is not relevant to COVID-19.
Yeah, I mean, listen, I think that employers do have that ability, especially if they do own the phones. I think if the employees own the phones, I think it's slightly different. I think that we're seeing, not necessarily contact tracing, but other examples. So Brigham Women's launched an app that's sort of a pass app where you put in your symptoms, and if you don't sort of meet sort of potential case definition of COVID, you get sort of green on your phone versus red. And that's seeing, incredible adoption. And I think a lot of acceptance on the employees is saying, okay, that's part of my, the job is to make sure I'm coming in healthy. And so I'm happy to sort of disclose whether I'm red or green. And so the adoption there has been incredible. There's been a lot of participation, almost no pushback. I think, in a healthcare setting, there is this recognition that you have to do things like, mandated immunizations and other things that are sort of important to protect your patient population. So maybe that could be different than, other industries that might, not be able to have that same sort of use case.
It also may be possible that those employees have a better sick leave policy. And so the repercussions of admitting that you're not feeling well are not as great as if you have an employer that's not going to pay you when you stay home.
Yeah.
And speaking of phones, John, you had a Nature paper come out this week.
Yes.
that I wanted to ask you about, because involved data from 300 million phones, correct? And to do mobility tracking. Tell us about that effort. I'd love to know how you got the data.
Yeah, this is probably one of the largest mobility data sets ever assembled that covers, majority of the world's geography. We essentially had access to data. So these are people on their mobile smartphones that have opted in to allowing their location to be sent to Google. And essentially we were able to build, the globe on a 5-kilometer grid where we could see the movement from one cell into another cell. For the entire, so a full matrix of movement. And so what that enabled is we could see multiple scales of population movement, local movement, inter-country, intra-country. And it revealed some really, basic things that we expect, like huge mobility during holidays, or reduce mobility in places that are dealing with conflict, or increase mobility in response to conflicts or climate change, clearly in response to infectious disease. Interesting findings that, might be counterintuitive, like there potentially is a thought that we see this massive influx of people coming in from Mexico and staying in the US. That actually wasn't the case. We see actually the same inbound and outbound travel between Mexico and the US, at least via smartphone. There could be bias clearly in that data, but that sort of goes against potentially some of these statements that, we're just getting completely inundated with, people from traveling from other countries. And so really that data set in itself is so important. We know that mobility data can play such a big role in understanding the spread of infectious diseases. Clearly at the beginning of COVID, you could see you could predict the spread based on travel data. So you knew exactly where you'd see the first cases. And then mobility data at a finer resolution can tell you about the impact of social distancing. We published another paper in Science, which essentially showed that we could estimate the reduction in mobility in Wuhan and how that directly related to their ability to stop the spread of coronavirus. And so that mobility data, and we're seeing companies, and again, I think Dina will have some good perspective on this, companies being more open about mobility because they have incredible data sets. So clearly, in our case, we work with Google. Facebook launched their own mobility data set that they put on their sort of data for good. Apple has their sort of city mobility data that, that is also providing insights. So all these companies have recognized that there is sort of a social good to that data, and they're beginning to sort of open those out in ways that, I would never have expected, prior to COVID.
And is there a privacy constraint, or is it just a matter of time? Is there anything that's preventing you from getting more granular in analyzing that data? And so it's, you can take into account the heterogeneity, right? So even in the city of Boston, you may see patterns that are different in Chelsea versus, some of the western suburbs and things like that. And that can guide potentially some of these public health opening decisions, right?
Yeah.
So is that on the radar?
When you get to the higher resolutions, it starts to get into the tricky sort of reverse identification of individuals. And this is why most of the companies, well, all of them, have really sort of provided sharing at a highly sort of aggregate level. But I agree, as these data sets become more available, people's acceptance of them changes, and then who knows, how geographically granular we can get in the future. But clearly we have to do so very carefully.
Yeah, I think the information can be extraordinarily helpful for public policy, but the fact that we're relying on individual companies to do the right thing and to protect the data on behalf of consumers just highlight that if we were to have a comprehensive privacy law that set a standardized framework for what's right and what's not right, then we don't have to rely on individual companies to do the right thing on their own and to also police how data is being used through their products.
And I just wanted to jump in. We're almost out of time, but I wanted to ask sort of a last question to John and to Dina, if you can sort of, pull out one or two things that make you optimistic about how technology can be harnessed and used in ways to respond to threats like this, and to what extent you see the technologies that are being used right now outlasting the pandemic in terms of perhaps making a difference in the care of patients going forward.
Well, I mean, listen, I think that the amount of work that's happened from a workforce that's at home and has sort of time to devote towards efforts has been really incredible. And clearly, many of the tech companies are relying on their academic partners to do development and analysis and setting up infrastructure that will last. I mean, we have an ongoing collaboration with Google right now where we have 9 engineers that are working on our team that are building an infrastructure that will get us, not only to help us with the current pandemic, but will help us with, future events. And really getting that kind of resource is incredible. I have been very concerned about the sort of transient nature of the tech involvement, and that correlates well with, the public health funding. And that generally is still a concern, right? Are we just going to sort of walk away from all this innovation that doesn't really take hold, and we're not going to learn for the next event, because there clearly will be a next event. We always thought it was going to be a new flu virus that might do this, so that is still on the table. So it's still a mild concern, but to see sort of these tech companies investing in public health and doing so in a thoughtful, sort of partner-driven way has been really amazing to see.
And I'm optimistic that what we're learning from this very painful public health experience can lend itself to improvements in our healthcare system and the way we manage public health issues. So for starters, a lot of connected technology that clinicians and researchers are now becoming familiar with today will lend themselves to expanded opportunities for telehealth, as well as decentralized clinical trials that collect real-time signals at home in real-life settings. That's something that was happening very slowly before, and it rapidly escalated now. So I'm optimistic that we're going to be able to continue on this track and realize some things that we didn't have before that actually we want to keep doing after COVID-19 is gone.
Well, with that, I think we're about at time and need to wrap things up today. But I wanted to say thanks again to John and to Dina for joining us today, and Harvard Medical School for working with STAT to produce these chats. Our next chat will be taking place next Thursday, May 28th, again at 1 p.m. Eastern. And that's going to focus on the foundations of reopening, including the realities of developing an effective vaccine and the importance of on the ground contact tracing. So thanks again, everybody, for being here. Stay safe and be well.
Thank you.
Hi, thanks for having me.